divide our time, Dr. Moning and I, between telling you what BVD is and why it's a problem and how it does produce all the negative impact it does. And then Volker's going to tell you strategies for controlling it and the benefits of that control. So bovine viral diarrhea as a clinical presentation, it's a name for a wide-ranging assortment of clinical syndrome caused by multiple species of viruses from the Pestivirus genus. And if you've been in any of the BVD talks today, you've seen this type of diagram multiple times. This is my version of it. And what we have here is originally we had BVD1. Then we found that there was another species, this was in the United States, called BVD2. Subsequently, BVD2 was found in a lot of places throughout the world. We'll talk a little bit more about that later. And most recently, we have something called Hobie-like viruses, originally coming out of Southeast Asia, and as we look harder, we find more of that too. So what's in a name? Bovine viral diarrhea virus. If there was a contest for the least informative and most confusing name for any clinical presentation in veterinary medicine, I think we would have a strong contender in BVD. Bovine viral diarrhea. For first part, bovine, it's really not just bovine, it's all even-toed ungulates. So not just cloven-toes, but rabbits also will sometimes get BVD. Viral, yes, it is caused by a viral. But diarrhea, not so frequently. Dr. Fox, when he first came across the first animal who subsequently was the case number 1, case 0 for BVD, it was presented as diarrhea, and he thought at first it was winter dysentery. And from there, everything was called bovine viral diarrhea, but we know now that diarrhea is rarely seen. And we have multiple presentations dependent on viral strain, presence of secondary pathogen, reproductive status, and age. So it has its biggest impact on producers, arguably as a reproductive disease, where we get fetal death, congenital defects, including persistent infection. We'll talk about that in a minute. Respiratory disease, it's rarely a primary cause of respiratory disease, but it is a strong contributor to bovine respiratory disease complex. Immune suppression, as Joe told us this morning, is really one of the most important things it does. And last but not least is enteric disease. So with the multiple hosts rather than bovine, we really could call this, use the initials for even-toed ungulate, viral reproductive disease, respiratory disease, immune suppression, enteric disease, which gives us half the alphabet. So I guess we'll just stay with BVD. But remember, it isn't always bovine, it's always viral, but it isn't always diarrhea. So the disease syndromes that come under that BVD tent, regardless of whether which species we're looking at, includes immunosuppression following acute infection, respiratory disease, reproductive disease, persistent infection, and mucosal disease, which is a really interesting and complex interaction between persistent infection and superinfection with another virus. It's probably not a loss leader for producers, but it's certainly from a scientific standpoint one of the neatest things they've ever found a virus to do. And then hemorrhagic syndrome, so far we've only been able to reproduce that under control conditions with the type 2s, but it has been reported with the type 1s. But not all type 2s are hemorrhagic. So viral species associated with this collection of clinical symptoms called BVD, and where are they found? So here's the first reports of them. I said we started with BVD1 in 1946 out of Cornell, BVD2 about 1987, then Hobie-like viruses first appearing in the literature in 2004, although now as we do retrospectives of isolates that are in people's freezers, we found out Hobie virus has been around a lot longer than we thought. We just didn't recognize it. This is just based on what's in the literature, what has been reported. BVD1 is found most broadly throughout the world. followed by BVD2, which so far has not been endemic in Australia, but does appear to be endemic in other places in the world, with some variation by country. Hobie-like virus, thus, we're just seeing it in Asia, Southeast Asia. Europe seems to be a recent introduction, and then South America. So while we have these 3 bovine pestiviruses involved, they do have some things that are alike. All of them replicate in immune tissues. That leads to damage of immune cells. Some immune cells are killed outright, and some are just don't work the way they're supposed to once you have an infection going. And this leads to immunosuppression because you're reducing the amount of immune tissue there, and you're also leading to malfunction of those cells. All of them have a non-cytopathic biotype that can cross the placenta, that gives us that persistent infection. And they are all antigenically cross-reactive, but we have to remember that just because they're antigenically cross-reactive, and you can recognize them using some of the antibody-based tests, that doesn't equate with cross-protection. And we'll talk a little bit more about that later. So let's talk about that bovine pestivirus host range. Originally, these were all recognized in cattle. Hobie-like virus is always presented in both cattle and water buffalo. We're still trying to untangle those knots to see if maybe water buffalo are the primary and cattle the secondary, but we don't really know. Detected in free-ranging wildlife species. I'm not going to go through all of them, but so far we don't have wildlife species with Hobie-like virus. Experimental in vivo infections. As you can see, these viruses will like to go in a lot of different species. And I'm just going to take a little bit of time to talk about this. Found as cell contamination in cell lines. So far, Hobie hasn't been detected as a contaminant to date, but we know that it's a major contaminant in fetal bovine serum coming out of South America in particular. But you see cat cells here. Using contaminated fetal bovine serum to grow cells adapts those viruses to your cells. And then if you use those cells to produce modified live vaccines, you have vaccines contaminated with one of these bovine pestiviruses. So I have people say, I don't worry about BVD contamination of my fetal bovine serum because I'm not working in cattle. As Andrea in her talk today gave us a quote from Ernst Peterhans that a lot of people are doing BVD research that don't realize they're doing BVD research because they're using contaminated reagents. And we really do want to worry about this, particularly in the production of vaccines as we adapt those viruses and then use them in vaccines if they're a modified live vaccine. So this is important. We won't talk any more about it today, but sometimes things keep me up at night, and this adaptation is one of them. So all the 3 species can exist as one of 2 biotypes, non-cytopathic and cytopathic. The more virulent, surprisingly, from the terminology, is the non-cytopathic. You would think the killing one, that cytopathic, would be the bigger problem. But the problem with the non-cytopathic, it's much more adept at hiding from the immune system than the cytopathic. The cytopathic is fairly quickly cleared compared to the non-cytopathic, which can really hide out quite well. Once again, Ernst Peterhans, I think the paper came out about 10 years ago, compared the pestiviruses to the mafia. And you had some pestiviruses, such as the cytopathic, where they were the type of thief that would just throw a brick through the window and reach in and get whatever they could, and the alarm went off fairly quickly, and they tried to get away. Non-cytopathic viruses are more like embezzlers. They get into cells, they do bad things, and they're good at hiding, but they're still doing damage. So non-cytopathic typical virulence, and I will never refer to a BVD as avirulent, because they all cause immune suppression, and the non-cytopathics are capable of crossing that placenta. So even if they cause a mild disease in a healthy adult, doesn't mean that they don't have impact. So non-cytopathic cause persistent infection. They are the most prevalent in nature. This is what we'll find most of the time. We do have a variation, even among the typical virulence, from ones that don't even cause a fever to those that do give you a fever. All of them do give you varying degrees of drop of lymphoid cells, some of them that can be defined as a true lymphopenia. Non-cytopathic, high virulence, these can also give you persistent infection, surprisingly enough. But in acute infection, they can kill animals. They are relatively rare. They do have an insertion. I'm not going to talk too much about that today, but once again, these viruses are just fun to play with. And they do result in the hemorrhagic syndrome. Cytopathic virus, no persistent infections. It's because the immune system can find them and get rid of them. Only found in mucosal disease cases. We rarely have outbreaks of cytopathic virus. They also have an insertion where they're picking up sequences from other pestiviruses or from the host. And we refer to them as naturally attenuated because they won't result in persistent infections. So a lot of our modified live viruses have cytopathic virus in them. Once again, I think there might be a international requirement for all BVD slide shows to have a slide of this type. Everybody has their own version. I borrowed this version from Bolker because his cows were prettier than my cows. So we have an animal who's pregnant. She is exposed to non-cytopathic virus. It infects her. It also infects her fetus. If that infection happens in the first 40 to 100 days, 6 to 7 months later, she's going to give birth to a persistently infected animal. That animal is persistently infected for life. It's immunotolerant. That means it can't tell the difference between itself and the virus. And virtually every tissue in its body contains virus. And these are the true typhoid Marys of the viral world. They are persistently infected and they're antibody negative. In the last two sessions of gestation, 2/3 of gestation, when animals are exposed, they're born virus negative and antibody positive. And for a long time, we thought these animals were home free. Born with antibody, they've shaken off the virus and they're fine. But we found that if we followed these animals through the lifetime, they had a higher incidence of respiratory disease and a lower reproductive value. So we can kind of draw some conclusions from this as we look. The less mature the immune system is, the higher the costs the animal pays for the infection. So in this very first 1/3 or 40 to 100 days gestation, that immune system is barely set up yet, and we get immune tolerance, and we can't recognize the virus anymore. In the last 2/3 of gestation, that immune system is a little bit more mature, but still those animals are born with holes in it. Once again, viruses are never there to do you favors. They'll hurt you one way or hurt you another. And so these animals had an immune insult in the last 2/3 of gestation and really never recover from that. So animals are not born with functional immune system. Depending on the species, they may be more or less mature. Cattle in particular are born with a rather immature immune system that needs to be set up. And it uses cells from the thymus to set itself up. So, and this is just talking about viruses in general and ruminant thymus. And the thymus is there in quite a large amount in neonates, and it naturally involutes with age. But stress and exposure to viruses results to early involution of the thymus. You start losing the thymus, and whatever function the thymus was supposed to do, it's doing it on less thymus then. In particular, Pestiviruses infection in the neonatal stage of life, this is the thymus size on a non-infected animal. That's one of typical virulence, where we might say that we didn't even really see clinical disease, and this is one of enhanced virulence. So you can see, even when we're not saying we have profound clinical disease, we're really knocking a hole in that thymus, that you can't recover from that. You don't make more thymus, you just function without thymus, and whatever the thymus was supposed to be doing it's doing it with fewer cells. So it's another indication that BVD infections are never doing you a favor, and the less mature your immune system is, the bigger divot it's going to make in it. So we talked about persistently infected animals, and not all persistently infected animals are the same. This is another one of those fun little mysteries about pestivirus infection in ruminants. They don't all have the same outcome, even if they're infected about the same time with the same virus. And this is from an outbreak in a South Dakota university research herd. They had 44 PIs born into one herd. They were born within 1 month. When we went back and sequenced the virus, they all carried the same virus. Followed them for 1 year and found that indeed 41% of them did die from mucosal disease. 12 died as neonates. 5% were just euthanized within 1 year just due to poor conditions. These are funky looking animals with weird coats and snubbed noses. Had some animals that looked normal, but then had sudden death with no lesions on posting. They just gave up the ghost one day, 15% of them. But here's what I'd like to show you. Sold for slaughter. 27% of them looked normal enough to go for slaughter, that you wouldn't walk into that pen and say, that's a PI animal. And that's what makes it hard sometimes to convince a producer that he should get rid of all the PIs. He's willing to get rid of these funky ones, and he doesn't have much say about the ones that die on him. But that percent, that looks normal. And so there got to be kind of an old wives' tale that having a PI in your herd was a really good vaccination program, because they're shedding virus all the time, and you do get some very high titers. But using a PI as a vaccination program is about the same as using pregnancy as a birth control device. If you're pregnant, you can't get more pregnant. So yeah, it's 100% effective, but you're still pregnant. If you're using a PI as a vaccination program, you still have BVD in the herd. You are experiencing all the losses that you would anyhow, so you need to get rid of the PI. And the reason we're experiencing problems because the PI is in the herd is we have increased reproductive loss in cohorts. There's a decreased resistance to other infections. Part of that is due to the immune suppression of BVD when you're constantly being exposed to it, but it's also because even if they have a high titer, the way the immune system works, it's not like a windshield where the gravel hits it and bounces off. It's more like a soccer goalie, where they have to actually stop the ball, receive it, and throw it back out. So it requires energy every time. It's not a sum-zero event. So when you have a persistently infected animal in your herd, you're doing the equivalent of vaccinating every day, 24 hours a day, and that immune system is constantly being irritated. It always has to respond, and there's a physiological cost to that response. So energy is being used in that response. It would have been used to fighting off other pathogens or making more milk or making muscle. It's too busy fielding these BVD balls coming in trying to get into their net. You have decreased milk production and rate of gain because you're using too much of your physiological bank to fight off these viruses. So controlling bovine pestivirus, infective control always starts with elimination of the PIs. But when you're going to talk about controlling bovine pestiviruses, you have to decide what your goal is. And as Dr. Brownlee told us this morning, you can either look at eradication, getting rid of it, which I guess we should all be saying elimination now, but we're going to because I had this on my slide already, we're going to call it eradication. Or you can talk about limiting losses, and you're going to live with BVD there. You're just going to try to mitigate what it's doing to you. So you have to decide what your goal is going to be. We do have some good tools on the ground for doing that. We have detection, which principally focuses on detecting and getting rid of that PI. We have a lot of vaccines out there, and we have some good biosecurity that's been developed that doesn't just work for bovine pestiviruses, but works for any infectious pathogen that gets into herds. So detection of that PI, we have a lot of different tests. We have tests that look for the presence of the virus itself. You can use virus isolation. That was originally considered the gold standard, but it's very slow. It's very expensive compared to the other ones, and it does require that you are using a laboratory that has no BVD in any of its reagents. You can go with the detection of viral protein, immunohistochemistry, or antigen capture ELISA. Immunohistochemistry really requires a qualified pathologist to read those cells. Antigen capture ELISA, we do have commercial kits out there that can be used. You can go for detection of the viral genome by principally polymerase chain reaction, and once again there are commercial kits for detecting that. Or you can just go with detection of exposure, which can be important when you have a fully integrated control program, but if the only thing you're doing is looking at serology, you just have a smoking gun. Now, my interpreter looked at me and said, "What do you mean smoking gun?" In any detective situation, like if a guy would walk into a room and all he sees on the floor is a gun that has smoke coming out of the end of the barrel, what you know is the gun's been fired. You don't know who's been hit, you don't know who fired that gun, but you know something happened. Serology, a positive serology, doesn't really tell us when it happened, how it happened, or what the damage was from it happening. So it can be used, but it has to be integrated with other components of a control program. So why is BVD control so complicated? Well, once again, we need to eliminate the PIs for any control approach to be effective, and there's no other disease control program that has this problem with the persistent infection. So I'm going to go through this 3 times. First, we're going to talk about detection, and then we're going to talk about control. So if you're talking about detection, you have to determine which species is in the population that you're plumbing, that you're surveying. You have to know your region, and you have to use a test that'll pick up the viruses that are in your geographic region. It would be in the best of all possible worlds, and of course we don't live in the best of all possible worlds, but in the best of all possible worlds, we would have diagnostics that would pick up each of these species and differentiate between these species. And just because God has a really weird sense of humor, in addition to having the 3 species, we also have subgenotypes between the species, and there's sometimes enough variability between those subgenotypes that they become an issue with detection. So which clinical presentation? Or do you want to detect acute infections, or do you want to detect persistent infections? Most of the time for detection, we're trying to go with persistent. There's always that nagging problem is, okay, is that a persistently infected animal, or is that an acutely infected animal? This animal needs to be eliminated. This animal needs to be allowed to recover. The standard has been that 2 positive tests, at least 2 weeks apart, to establish persistent infection. And once again, that's in the perfect world, that's how it would be done. Frequently in the field, it's just 1 positive test. And which populations to survey? Well, it'd be great if we could survey the fetuses and get rid of them before they hit the ground. There's really no good test and no way to do that. We could have used amniocentesis, but that certainly isn't cheap enough to use on a regular basis, and it can endanger normal pregnancies. Neonates, another good time to go in and eliminate those animals as quickly as possible, and many control programs focus on testing of neonates. Breeding stock is another good place to look for detection of PIs and get rid of them before they enter into the breeding cycle and generate more PIs. Unfortunately, where I live in the United States, we're doing most of our testing here in feedlot stock, so animals that are destined for slaughter, which is great if you remove them as they enter the feedlot. It does increase the bottom line for the feedlot producer, but it doesn't do anything about eliminating the number of PIs that are in the environment, because these animals don't reproduce. So if we're going to talk about prevention, then once again we run into the same problem. If you're going to vaccinate, do you have to worry about Hobie-like viruses in the region that you're going to use that vaccine? Are you primarily 1 or 2? In the United States, our vaccines now have type 1 and type 2 in it, because we found out that we actually needed both of those to make a good vaccine that gave us a broad range enough to protect what we were seeing in the field. So as you look at your country, you're going to have to decide what you need. Which clinical presentation are you trying to prevent? If you're going for acute, you don't have to have very high titers. On the other hand, if you're trying to prevent persistent infection, that requires very high level of an immune response. And if you want to prevent 100% of persistent infections, then you need a near sterilizing immunity. Yeah, what population are you trying to protect? If you want to protect the fetus, you really have to have protection in the dam. If you want to protect the neonate, you can vaccinate early, but remember that immune system's not mature in the early days of life. Plus, we have colostral antibodies there that might interfere with vaccination. So sometimes the best thing you can do for a neonate is make sure they get good high titer colostrum and get antibodies, passive antibodies that way. Breeding stock, we would like the protection in place before we breed those animals to protect that pregnancy. And the feedlot stock, we would really like to see those vaccines be done as a background rather than when the animals hit the feedlot themselves, because it does take 2 weeks to establish an immune response. So how big is the problem? The control programs in Europe have generated quite a bit of information on how much pestivirus infection there is in Europe. We have a little bit done a few surveys in the US. We have a little bit of information there. But as I looked in the countries that would be surrounding where we're having our meeting today, you can look at the serologies there and the species and subgenotypes that are present, and that you are seeing them in hosts other than cattle. The problem with going through the literature and trying to draw many conclusions from the literature, very few of these were actually designed as real surveillance. People were already selected for sick animals. They were looking at animals with diarrhea, or they were looking at abortions. So the high levels of PI prevalence listed here, I don't know if that's representative of the population. The serology might be more representative of the amount of exposure out there. But as you can see, these viruses are in animals throughout Asia. And are a problem, even though there are other things that people are worried about, it's like foot and mouth disease or those viruses that could possibly go between humans and animals. So it's hard to, you've been living with this, so is BVD or these bovine pestiviruses really a problem? Yes, they are a problem. They may not might not be able to walk out into a lot and see 60% of your animals due to a pestivirus infection, but they certainly are eating away at your bottom line. I had a producer told me that having a bovine pestivirus around is the equivalent of being nibbled to death by a duck. It just keeps chewing on you. And then what are the odds of buying or importing a PI? Sometimes people get a little unimpressed when they say, well, we have an incidence of PI that's less than 1%, so that's only 1 in 1,000. Well, remember, that animal's also shedding all the time, so it's not like they're ever going to get any better. So even however low rate your PI is, it's always better if it were 0. But just to give you an indication of how that PI rate affects you, if we have a rate of less than 1%, so 1 in 1,000, if you bought 10 animals or imported 10 animals, you'd have a 1% chance. So roll the dice, that one's not so bad, but who only brings in 10 animals? If you have 100, well, you're up around about 10%. You get up bringing in 1,000 animals, which most countries will import 1,000 animals a year, and you're not testing, you have about a 60% chance. I would take 60% chance of winning in Vegas, but I don't want a 60% chance of bringing a PI in. So 1% will give you, as you get up to 1,000 animals, will give you almost 100%. You're almost assured of bringing in PIs. And the reason I'm showing you this is that we need testing programs for import-export for any time we, within a country, as we're trading in animals, we should be considering what their status is. And at this point, I hope I haven't depressed you too much, but if I have, Dr. Monig's going to tell you what you can do about it.